Hello, this is Dr. Antonella Garbacea, and today our topic is terminal dentition due to periodontal disease. If you do have periodontal disease, you've been treating and battled this with a lot of years of treatment. Maybe the case presentation today will answer some of the questions. When you have a lot of bone loss, recession, some of your natural teeth and implants have lost bone support and gum tissue, we do have an answer for this. Most of the time we can rebuild the bone, remove the hopeless teeth, and actually connect multiple implants with a beautiful bridge that can assure aesthetics and good function for you. So here's the case I'm going to present today. We receive patients that are looking to improve their smile, improve their chewing, improving their function. And we definitely see, like in this patient example, a lot of recession, a lot of bone loss. This patient is wearing a couple of implant crowns, and there is a posterior flexible partial dentures on the lower arch. So the patient has a hard time chewing. Teeth are having mobility. If we look at the radiographs, we also understand that there have been some root canals, there has been some bone loss around natural teeth and implants, and she has a very hard time chewing with her back teeth because there is a lot of bone loss, as we can see from these images. So in these situations, where it's a terminal dentition, we do have hopeless teeth. We have to extract all those remaining teeth and build the bone, either regenerating with sinus grafts or regular bone grafts throughout the extraction process, and place multiple implants. And the first set of provisionals we have provided for this patient is addressing the main goals. That's addressing smiling, it's addressing a beautiful set of lip support, maxillary teeth, mandibular teeth, from molar to molar. In some situations, this is a starting point. So our patients, like for example, our lady patient here desires a little bit more display, a wider smile, larger teeth, and maybe even a better way of chewing. So in this situation, she requested to display more of the anterior teeth and actually have a little bit taller bite. We call it vertical dimension. So we increased the occlusal vertical dimension. We took records, and with our in-house laboratory, we are able to generate a full smile, a new design, smile design, to accommodate some of those aesthetic requests and functional requests. So the master cast together with a facial generated design can produce prototypes. Our prototypes in-house, we can mill them or print them. In that situation, the prototypes are sitting on the master cast. They are finished with a beautiful optic-glazed resin, and we are ready to place them intraoral. Patients is able to try them for a couple of weeks, show them to their friends, to their family, and enjoy more or less a different smile design. Once we are ready to process the final restorations, we want to make sure that we are having a very good stable impression, and the verification jigs that you see in this image, we are using to make sure that our records are as accurate as possible. Then it's the material selection. This is a zirconia pack. It's the ceramic material, very common nowadays in dentistry. And this is an Ivoclar digital block for BL2, so it's a bleach shade. The way we process zirconia, we mill it, we sinter it, and then we infuse it with different beautiful water stains. And it gets glazed, ultimately becoming vibrant and very aesthetic. In this situation, we are replacing teeth and gums. For the upper arch, we have 8 implants actually, and we do have the full arch one-piece ceramic bridge. Implants distribution is very beautiful. We have micro and micro texture. The maxillary bridge is infused and it is glazed with beautiful ceramic glaze. Ultimately, the attachment to the implant sleeves is done very precisely. We're using high quality cements, and the bond is assured between the titanium and zirconia. Ultimately, our patient is wearing those beautiful bridges for many years. At the end, we want to make sure that she has a good follow-up for maintenance. We want to make sure that those implants will last for a very long time under a very good care, and she's very happy with her smile. So this is the concluding the patient presentation, and this is the message, my message to you. If you do have periodontal disease, if you have terminal dentition, there is many years that you fight it to keep your teeth, it's time to let go. We can provide you with beautiful and very highly accurate, very stable ceramic implant prosthesis. Thank you very much for listening.